Part 4. The vessels of mesentery and hepatic portal vein. This is the mesentery. It has two layers. This is the root. This is a fan shape. The vessels inside here, the trunk is superior mesenteric artery in the root. Then its branches. First branch is the jejunal arteries and the iliac arteries. Supply the jejunum and the iliac. The second branch is here, ileocolic artery. Supply the lower 1/3 of ascending colon, and the second, one from appendix and the terminal part of iliac. The third branch is right colic artery. Supply the upper part of colon. The fourth branch is middle colic artery. Supply the transverse colon. The last branch is inferior pancreatic duodenal artery. Supply the heart of pancreas and the horizontal part and the ascending part of duodenum. Inferior mesenteric artery, directly from the anterior wall of aorta. Its three branches. Left colic artery, supply the descending colon. Sigmoid colic arteries, supply the sigmoid colon. And its terminal branch is superior rectal artery, supply the upper 2/3 of the rectum. About the hepatic portal vein, it's about 7 centimeters long, enter the liver. It's formed by the splenic vein and superior mesenteric vein. Now, there are 7 big tributaries of hepatic portal vein. The first is superior mesenteric vein. Second is splenic vein. The third is inferior mesenteric vein. The fourth is left gastric vein. The fifth is right gastric vein. The sixth is cystic vein. The seventh is periumbilical vein. This time is to dissect the vessels of the mesentery and the hepatic portal vein. The superior mesenteric artery, inferior mesenteric artery and their branches, the hepatic portal vein and its tributaries. The transverse colon. Now put the transverse colon and the greater omentum upward, then expose the small intestine. Put it to the left side, we can see this is the mesentery of small intestine, or just called mesentery. This is the lower border of the pancreas. Here is the cecum and one from appendix. Now this is the root of mesentery, or this is the course of superior mesenteric artery. Cut open this peritoneum. We will expose the superior mesenteric vessels. There are some superior mesenteric lymph nodes. Superior mesenteric artery is trunk. Right to it, superior mesenteric vein. The border of the body, pancreas. Now here is the head of the pancreas. So this part is behind these superior mesenteric vessels. They are superior mesenteric plexus. They are nervous plexus. Superior mesenteric artery. Behind it, you can see these two arteries supply the pancreas and the duodenum. So they are anterior and posterior branch of inferior pancreatic duodenal artery. This is also superior mesenteric lymph node. This is a part of the jejunal artery, the ascending branch and the descending branch. Jejunal artery, also two branches, and these two branches anastomosis together is arterial arch. They are straight arteries. This is a part of ilium artery. Now, to form these arterial arches, usually 3 to 4 grades of arterial arch. Also, straight arteries supply the ilium. Now, this is the duodenal jejunal flexure. Above this flexure, this is a suspensory ligament of the duodenum, or trace ligament. This is a very important landmark to make sure where is the beginning of jejunum. Then dissect the mesentery to expose these jejunal vessels and the ileal vessels. Now the trunk of superior mesenteric artery. These branches, they are jejunal arteries from the left wall of this trunk. To form the arterial arch, they are lymph nodes inside the mesentery. Now this is the ileal arteries, arterial arches. Then these straight arteries. From the right side, dissect the peritoneum to expose these side branches, right side branches. There are 3 branches: middle colic artery, right colic artery, and ileocolic artery. So they will supply the colon, cecum, and vermiform appendix, the large intestine. This is a trunk of superior mesenteric artery. This is a middle colic artery. It has a left branch and a right branch and a left branch. The middle colic artery, it has an ascending branch and a descending branch. Ascending branch anastomosis with its right branch here. Descending branch also anastomosis with ileocolic artery. Then this also arterial arch is similar to the small intestine. Then send off straight arteries to the colon. expose the ileocholic artery. This artery supplies this part. Cecum, ascending colon, ileum, one from appendix. Ileocholic artery. Two branches, ascending branch and descending branch. Or ascending trunk, descending trunk. From this upper trunk, some branches, they are colic branches, supply the lower one-third of ascending colon. Then from lower trunk, there are two cecal arteries. These two cecal arteries supply the cecum. Also from lower trunk, this is branch, ileal branch. Ileal branch supplies the terminal part of ileum. Then it anastomoses with this terminal branch of superior mesenteric artery. Still from this lower trunk, look at this branch supply the one from appendix. So this is appendicular artery. Behind the ileum, open this parietal peritoneum. Still expose the appendicular artery. You see, appendicular artery. Now this white layer is a mesoappendix triangular shape. So this appendicular artery and vein, they travel in the free border of the mesoappendix. And the center of the branches to the apex, body, and the root of appendix. So in the appendix, there is no anastomosis with other arteries. If this artery blocked, then this appendix liable to be ischemia or necrosis. This is branch to the body, to the appendix. Put the small intestine to the right side, then expose the inferior mesenteric artery. From the surface of this parietal peritoneum, look at this is aorta, abdominal aorta. This is inferior mesenteric artery. Then expose it. This is inferior mesenteric plexus, novis plexus. Inferior mesenteric artery. 3 branches. The first branch is left colic artery, ascending branch and descending branch. This one is, yes. Descending branch supplies the descending colon. Ascending branch still to the transverse colon, then anastomoses with the branch. This is the left branch of middle colic artery. Next, second branch is the sigmoid colic artery. Travel in the transverse sigmoid mesencolon. Supply the sigmoid colon. Another sigmoid colic artery. The third branch is superior rectal artery. Supply the superior part of rectum. Superior mesenteric vein is right to the artery, then behind the pancreas. Between the inferior mesenteric artery and the left ureter, we can see this vein. This is inferior mesenteric vein. Separate it. Here, behind the pancreas, you can see splenic vein, superior mesenteric vein, and the inferior mesenteric vein. In this case, it enters the superior mesenteric vein. Somebody it enters splenic vein or enter this angle. These two veins form the hepatic portal vein behind the neck of the pancreas. Hepatic portal vein here. First cut a part of quadrate lobe of liver. Expose the portal hepatis. Then cut the left and the right hepatic duct. Cut the right hepatic artery. This hepatic portal vein divided into two tributaries, two branches, into the left lobe and the right lobe. Star mark here. Left gastric vein directly enters the hepatic portal vein, then enter liver. Right gastric vein also directly enters the hepatic portal vein, so they are two direct tributaries of hepatic portal vein. Esophagus here. Abdominal part of esophagus. This is the esophageal vein enter the left gastric vein. This is the left gastroepiploic vein enter the splenic vein. The right gastroepiploic vein. Then finally enter the superior mesenteric vein. Summary: hepatic portal vein is in the hepatoduodenal ligament. It behind the proper hepatic artery and common bile duct. It's formed behind the neck of pancreas. It's formed by the splenic vein and superior mesenteric vein. The tributaries of hepatic portal vein. Tributaries: first is splenic vein, second is superior mesenteric vein, the third is inferior mesenteric vein. This is 3 tributaries. And other tributaries, for example, the left gastric vein and the right gastric vein and the cystic vein, paraumbilical veins. There are 7 big tributaries.